Preventing VRE infections in St. Joseph Health Center, Nursing Leadership, Evidence-Based Solutions, and Environmental Theory. Good morning, everyone. Today we'll be discussing vancomycin-resistant enterococci or VRE. VRE are bacteria that have developed resistance to vancomycin, a key antibiotic used to treat serious infections. They are typically found in the intestines and female genital tract, but can cause severe infections in hospitalized patients, especially those with weakened immune systems. VRE has become a global health concern, recognized by leading organizations like the World Health Organization and the Centers for Disease Control and Prevention. Over the years, the epidemiology of VRE has changed, with rising resistance observed in Enterococcus faecium. This raises critical questions about the effectiveness of our current strategies and the need for renewed efforts in infection control. Although Canada initially detected VRE in 1993, infection rates have been modest. However, VRE-related bloodstream infections are raising concerns due to their increased morbidity, hospital stays, and healthcare costs. In Ontario, where screening procedures have been inconsistent, VRE infections have increased, according to recent studies. Relaxing screening measures increased infections from 0.4% to nearly 1.2%. Dr. Jeannie Johnstone's research stresses continuing screening and isolation methods for VRE management. The graph indicates St. Joseph Health Center concern about hospital-acquired antibiotic-resistant bloodstream infections growing. From January to March 2024, the rate of new cases was 0.038 per 1,000 hospital days and 96 new infections. This suggests greater infection control, antibiotic stewardship, and continuing monitoring to address this developing issue. Higher risk of becoming infected with VRE. Patients with weakened immune system, those who have been previously treated with vancomycin or other antibiotics for a long period of time, those who have undergone surgical procedures, and those with medical devices such as urinary catheters.
Now, let's discuss the proposed plan to address VRE. First, engage key stakeholders. Collaboration is vital. Engaging infection control experts, healthcare workers, and patient representatives will ensure a well-rounded approach. Second, conduct risk assessments. We must identify high-risk areas in our facilities and vulnerable patient populations to allocate resources effectively. Third, establish screening protocols. Screening patients upon admission, particularly those with risk factors, allows for early detection and timely intervention. Fourth, design education programs. Regular training on VRE prevention strategies, hygiene practices, and PPE use is necessary to keep healthcare workers informed. Let's proceed to the do phase where we can collaboratively take meaningful steps towards our objectives. First, implement screening and isolation protocols. Begin screening high-risk patients and isolating those identified as carriers. Second, enhance hand hygiene. Promote strict hygiene protocols, including regular cleaning of high-touch surfaces. Third, roll out staff training. Mandatory training is crucial for ensuring knowledge and adherence to protocols. Fourth, monitor compliance. Establish systems to track adherence to all protocols, allowing for ongoing evaluation and improvement. To evaluate our initiative's success, we will track several outcomes. First, decrease in VRE cases. A reduction in cases post-implementation demonstrates the effectiveness of our strategies. We aim to decrease the VRE case rate from 0.038 to 0.033 in the hospital over a 6-month period. Second, improved hand hygiene compliance. We aim for an 87.7% compliance rate in hand hygiene practices among staff. Third, enhanced environmental cleaning. Positive evaluations of cleaning processes will indicate a significant impact on infection rates. Fourth, positive staff and patient feedback. Increased satisfaction among staff and patients is a key indicator of the program's success and acceptance.
The barriers in our proposed solutions: staff resistance to change. We will conduct training sessions and engage staff in protocol development. Resource limitations. Identifying necessary resources and collaborating management can help address this. Budget constraints. We will present data showcasing the cost-effectiveness of our strategies to secure funding. Limited patient awareness. Developing educational materials will facilitate better understanding among patients and families. Data collection challenge. Implementing efficient data collection systems will help track progress. There are three impacts of our initiatives. One is staff impact. By involving staff in protocol development, we enhance their autonomy, commitment, and professional development. Second, leadership impact. Leadership plays a crucial role in resource allocation and encourage evidence-based decision-making. Third, patient-client-family impact. Improved adherence to infection controls will lead to better health outcomes, increased patient engagement, and stronger trust in healthcare providers. Transformational leadership empowers and motivates employees, promoting creativity and collaboration. Florence Nightingale's environmental theory emphasized the needs of hygiene and sanitation in preventing vancomycin-resistant enterococcus spread. This dual strategy improves care quality, patient, and worker safety.
The 5-year ladder plan for BRE prevention enhances awareness, SOP integration, leadership involvement, resource adequacy, and effectiveness evaluation to ensure sustainable and adaptable prevention efforts. Sustaining change in the effective management of BRE requires sufficient healthcare staffing, budget for training, and access to data management system. It also involves the availability of infection control tools, hygiene standards, and prevention initiatives. And ongoing education and training programs for staff and regularly updated standard of procedures are essential to effective management of BRE and adherence to infection control practices. Addressing BRE in the healthcare settings is crucial and requires a strong focus on improving patient outcomes with reducing infection rate. A structured and proactive approach is essential for effectively managing and controlling infections. This strategy will enhance patient safety and establish a strong culture of vigilance within healthcare facilities.